On March 20, 2026, a date that will change Indian healthcare forever, the patent on one of the most powerful drugs ever created expired in India. Semaglutide, the molecule behind Novo Nordisk's blockbuster drugs Ozempic and Wegovy, is now open for generic competition in India. Dozens of generic versions of the drug are now entering the market at significantly lower prices. Media Cube. Sun Pharma, Dr. Reddy's, Zydus, and Mankind are among the first movers, with prices expected to fall by up to 90% from current levels. Over 40 Indian pharmaceutical companies are preparing their own versions. This means that within months Ozempic will be available to millions of Indians who could never afford it before. But here is the critical question: do those millions of Indians truly understand what this drug does to their body? Today, as a postgraduate medical professional, I'm going to give you the complete, honest, evidence-based truth about Ozempic, what it does, who should take it, who should never take it, and the side effects that nobody is talking about. Please watch till the end. This video could be the most important health decision you make in 2026. Welcome to MediVista, Health Explained Simply. Every video on this channel gives you accurate, evidence-based medical knowledge in simple language. Before we go into the benefits and risks, let me explain exactly what Ozempic is and how it works in your body. Because most people have heard of it, but very few truly understand the mechanism. What is Ozempic? How it works? Ozempic contains a molecule called semaglutide, which belongs to a class of drugs called GLP-1 receptor agonists. Ozempic works by mimicking GLP-1, a hormone your body naturally releases after you eat. It helps you feel less hungry, slows stomach emptying so you stay full longer, boosts insulin release when blood sugar is high, and reduces glucagon, so your liver releases less glucose into the bloodstream. Satori Review. Think of it this way: your gut normally sends a signal to your brain saying, "I have eaten, I am full, stop eating." Ozempic amplifies that signal dramatically and keeps it running far longer than normal. The result is you eat less, your blood sugar drops, and your body begins burning stored fat for energy. It sounds almost too good to be true. And as with everything in medicine, the full picture is more complex. Let us go through the proven benefits first, and then the side effects that every Indian must know. 5 proven benefits. Benefit number 1, and the most established, dramatic blood sugar control. Ozempic is approved for the treatment of type 2 diabetes in adults to improve blood sugar levels when used together with diet and exercise. Satori Review. A real-world case from India published in 2025 showed that a patient with poorly controlled type 2 diabetes saw their HbA1c improve from 9.8% to 6.1% over 12 months on semaglutide, a transformation that most oral diabetes medications struggle to achieve. Satori Review. For the 100 million Indians living with diabetes, this level of blood sugar control is genuinely life-changing. Unlike older diabetes drugs, Ozempic does not cause hypoglycemia, dangerously low blood sugar, on its own. This makes it significantly safer than many existing diabetes medications. Benefit number 2. Significant and sustained weight loss. 3 recently released Cochrane reviews, the gold standard of medical evidence, conclude that GLP-1 medications like Ozempic can lead to meaningful and clinically significant weight loss. The active ingredient in Ozempic, semaglutide, does work for weight loss according to research. It also slows digestion by increasing the time food takes to leave the body, an effect similar to bariatric surgery. Clinical trials show average weight loss of 10 to 15% of body weight over 68 weeks, and at higher doses used in Wegovy, up to 15 to 17%. For Indian patients, where abdominal obesity drives diabetes, heart disease, and fatty liver, this weight loss can be genuinely transformative. However, and this is critically important, I will explain what happens to that weight when you stop taking the drug. Please stay till the end. Benefit number 3. powerful cardiovascular protection. Research published in late 2025 in Nature Medicine found that both semaglutide and tirzepatide reduce the risk of heart attack, stroke, and death from any cause. Research in the Lancet Diabetes and Endocrinology in 2026 found that people with type 2 diabetes who took a GLP-1 and practiced healthy lifestyle habits had up to a 60% lower risk of stroke, heart attack, or cardiovascular death. Semaglutide is proven to reduce the risk of major cardiovascular events by 20%. For India, where cardiovascular disease kills 5.2 million people every year, this is enormously significant. In fact, in patients with established heart disease and type 2 diabetes, Ozempic is now considered a cardiovascular medication as much as a diabetes medication. Benefit number 4. Kidney protection. The SUSTAIN 6 trial showed that semaglutide reduced new or worsening nephropathy by 36% in patients with type 2 diabetes. A 2025 Indian case study confirmed that a patient with early diabetic kidney disease saw urine protein drop from 267 to 34 mg per gram, and kidney filtration rate improve, over 12 months of semaglutide therapy. Ozempic is now approved to reduce the risk of worsening kidney disease and heart-related death in patients with type 2 diabetes. Satori Review. Given that diabetic kidney disease is one of the leading causes of kidney failure in India, this benefit alone makes Ozempic one of the most important drugs in Indian medicine today.